All right, welcome back to the Lex Dynamic channel. And today is going to be a post about politics, and specifically, it's going to be a post about what's going on with healthcare. Let me get right into it. Trump and Republicans are trying to kill Americans and make them sicker. There is no other way to put this. If I could find another way to put this, I would. But that is literally the most accurate way of putting it, is that Trump and Republicans are trying to kill Americans and make them sicker. There is no other explanation for what's going on in healthcare. You remember the shutdown that we had a few weeks ago that lasted, I think, 42 days, and various parties were blaming each other. Look, I'm not a Democrat and I'm not a fan of Democrats, but the Republicans were absolutely responsible for that. What did Democrats want? They wanted more affordable healthcare. What did Republicans want? To take away healthcare from you. That's it. That's what this fight is all about. And let me explain to you what is going on right now and what the stakes are. So, Congress is going on vacation next week, and boy, these people need a vacation like my fat ass needs to eat 7 hot dogs at Costco tomorrow, which might be my plan anyway, but I really don't need it. These assholes do not need a vacation. Why the fuck are they going on vacation when 24 million Americans are at risk right now for losing their health care? So, and they're going to be out until January 5th. And here's why this is important. Okay? So, Americans need to choose their plans if they are under the Affordable Care Act, better known as Obamacare, by December 15th in order for coverage to begin by January 1st. The problem is that there are subsidies that made healthcare for 24 million Americans more affordable, still expensive because our healthcare system is so fucked, but more affordable, that are getting ready to actually expire. And Congress needs to do something about it, but they're not. And what are health insurance companies going to do? Well, if they're not getting subsidized by the federal government, they still have fixed costs, they're going to jack up your prices. Oh, and it's healthcare companies that are at fault, right? Well, listen, I'm not going to sit here and defend America's health insurance system. Those people are absolute fucking pure evil. But at the same time, Congress has something that it can do about it right now that it's refusing to. Well, Republicans in Congress. Trump has something that he can do about it right now, but he's refusing to. All right, let's talk about how we got here. So, the way that Obamacare works is that let's first talk about what happened before Obamacare. For the longest time in America, healthcare costs were rising year by year at very high rates, sometimes 8 to 12% a year. And this was completely out of control. Now, what Obamacare was designed to do, but really has failed, is to actually control some of those costs. Now, let's just be clear about something. 2 things, actually. This notion that our healthcare in America was great before Obamacare and that Obamacare ruined everything, pure nonsense, all right? Absolute and complete nonsense. Healthcare in America has been fucked for a very long time. Number 2, that Obamacare has failed to address many of these issues. Yes, that's true, but remember, under Obamacare, there was supposed to be a public option that was actually going to make Medicare available for everyone so that people could have affordable health care, and Republicans killed it. So, it's really hard for Republicans to blame Obamacare when they're the ones who actually neutered the law in the first place. And I don't worship at the altar of Obama. I don't think he was a particularly good president. But let's actually be honest here about what happened. We still could, by the way, have Medicare for all, but nobody gives a shit about people in America, especially not members of Congress. So why would we actually have something useful like that? So in any case, under Obamacare, in order to share some of these costs, there were subsidies. So the government basically would help offset some of the costs of healthcare insurance premiums for the Americans who most needed the offset. And that makes sense. Health insurance is expensive. The government comes in there and basically takes care of a lot of these other costs that people would have. And the subsidies would rise as the cost of healthcare would rise. Well, they have continued to rise. So normally what happens is that households will pay a percentage of their income toward a premium, and then a tax credit subsidy will go to cover the rest. It comes directly from the government, and it goes to pay out insurance companies. That way, the insurance companies, even though their costs are high, actually do not completely get out of control with premiums, and Americans can still get health care. Now, what the enhanced subsidies that Democrats have been fighting for do is actually continue to boost those subsidies every year. Well, what Republicans want to do is bring back the value of those subsidies to pre-pandemic levels. That is billions of dollars. What does that mean? Well, insurance companies still have those costs. They're not going to cut their premiums. Medical providers are not going to cut their premiums. The government's not paying for it, so who's going to bear those costs? You. You are going to pay those prices. There is no other way around it. There is no free lunch. Someone has to pay for this stuff. Okay? And let's talk about how bad it can be. And I'm going to pull from a couple of articles. I'm going to link them in this video. Let's talk about one woman, Daniela Perez from Chicago, a 34-year-old education consultant who says her current plan will increase to $1,200 a month from about $180 a month this year without an extension of the tax credits. $1,200 a month. Think about that for a second. For an education consultant, that is $14,000 a year in healthcare costs. That's just out-of-pocket premiums. We're not even talking about deductibles and all of the various other things that you have to pay for out of pocket. Let's hope that Daniela doesn't get sick, because then she's going to go bankrupt, because there are so many medical bankruptcies in America, because again, our country is fucked. So, quote from Daniela Perez, "I'm not super hopeful. Seems like everything is in gridlock." Yeah. Who brought it into gridlock? Republicans. What have Democrats been saying all along? Look, just pass the subsidies. Continue to go with the system that you're going with right now. If you want to work on it later, that's fine, but we're in crisis level right now. See, what's going on here is the Democrats see a house that's on fire and say, pick up a fucking hose. And Republicans are saying, well, is it really a fire? How hot is the fire? What's the best way to fight the fire? Is it with this kind of water, or is it with some other kind of method that we can use? Do we need a red truck, or do we need a blue truck? What the fuck? People are getting ready to lose their health care. Just extend the subsidies. California reported a 33% drop in new enrollments through December 6th. Yes, people aren't signing up for healthcare because they know it's going to be too expensive. And it's not just a blue state problem. Don't start with this bullshit. California, everything's really expensive. Okay, how about Pennsylvania? Pennsylvania voted for Trump. Pennsylvania, the first 6 weeks of open enrollment there was a 16% decrease in people signing up for the first time compared with last year, according to data posted by Penny, the state's ACA and insurance marketplace. For every one of those new enrollments, 1.5 existing customers canceled, Penny reported. Yeah, so you've got people signing up, but more people leaving, again, because they can't afford it. And think about what's happening. People are actually playing games with their own health because America's not fucking taking care of them. The hell is the point of having a government if it's not actually going to assist you in living your life and help you in the most basic thing, which is your health? Let me quote somebody else from another article here. Quote, they said, based on our salary, we don't qualify, said Deborah Nowicki, who at 64 is retired while her husband, 62, still works. They live in Southern California and are looking at coverage going from $1,000 a month this year to $2,400 a month next year if they stay in the same plan. Quote, how can you have health insurance that is more than your rent? That's a damn good question. And these are people in their 60s getting ready to pay $2,400 a month, nearly $30,000 a year just to cover premiums. And remember, because they're older people, they're more likely to need additional care, ambulances, medication, hospitalization, surgery. All of these things cost money on top of the premiums. How are these people going to live? By the way, I'm here to push my music. I played some of it at the beginning, and please check it out by me, Lex Dynamic, for free on Apple Music, Spotify, and all the rest. You heard some of it at the beginning. It's all instrumental. So let's talk about what Democrats want as opposed to what Republicans want. What Democrats want is very simple. Increase the subsidies. Just keep increasing them like you have before. If that doesn't happen, the subsidies revert to pre-pandemic levels. Well, what were pre-pandemic levels? Think of how much more expensive the past things have gotten in the past 5 years. If you keep the reimbursement rate at what it was almost 6 years ago now, of course the costs are going to go up. And of course they're going to be borne by individuals. So the Democratic plan is simple. Just continue to fund this. What do Republicans want? I have no idea. And they don't know what they want either. Let's just take a look at a quick history here. You remember when we were arguing about Obamacare, when Obama came into office? Republicans never had any kind of a counterproposal. It's not that I'm in love with the idea of Obamacare, but fine, if you don't want Obamacare, well, what else is there? I don't like eating broccoli and kale, but if that's the only thing on the menu, then I'm going to eat it up. I'm going to sit there like a rat eating it up. Speaking of rats, there are plenty of them in Congress. Come up with a counterproposal. Then they tried to get rid of Obamacare. Okay, many times. Hundreds of times. And it never worked. Because you don't have a counterproposal. Fine, if Republicans had a plan, go ahead, bring it out. And Trump, what did he say before? We're going to replace Obamacare with something great. He has been in office right now for 5 years. In 3 of those years, he has had complete control of the government. That is the Supreme Court, the House of Representatives, and the Senate. They have not even introduced a health care bill, let alone actually passed one. Where is your something great? During the debates, what was he talking about? Well, I have the concept of the plan. Let's see your fucking concept. Fine, even if you don't have a full plan, which you don't. Let's see the fucking concept. There is no concept. All Republicans want to do is fucking bitch about a plan, but not actually present any kind of alternative. It's really easy to complain about shit. It's much harder to come up with some kind of an alternative. Oh, but they have come up with an alternative, right? Okay. Well, a Republican bill by U.S. Senators Bill Cassidy of Louisiana and Mike Crapo of Ohio would have sent up to $1,500 to individuals earning less than 700% of the federal poverty level. That's about $110,000 for an individual or $225,000 for a family of 4 in 2025. Okay, what the hell does $1,500 do? When you're talking about some of these people that I talked about in California, when their premiums are getting ready to go up $1,400 a month, what does a one-time payment of $1,500 actually do? Their premiums are getting ready to go up nearly $18,000 in a year, and you're giving them $1,500. Great. Where's the other $16,500 coming from? That does nothing. That's the appearance of doing something without the accompanying reality of actually doing anything. Well, and what they want to do, what Crapo and Bill Cassidy want to do is put some income limits, saying, look, if you're above a certain income level, then we're not going to give you subsidies. Fine. Don't give people subsidies. If you're above that income level, okay, you're making more than $100,000 a year, 110, 120, whatever the hell it is. Okay, don't give people those subsidies. That's a separate conversation. But why are you screwing the people who are most vulnerable in the process? Why are you going to the people who are making $40,000 a year, $50,000 a year and saying, up yours, we're giving you nothing? And let's talk about Bill Cassidy for a while, because he fucking sucks. I have a special place in my heart for contempt for Bill Fuckface Cassidy. Bill Cassidy is a smart guy. He's a senator from Louisiana. He was a doctor. Right? This is not an incapable, incompetent person. He knows exactly what he is doing, and that makes it even worse. See, Trump is a fucking moron. Cassidy's a very sharp guy, but he's even more fucking evil than someone who's a moron and doesn't understand what he's doing. See, several months ago, when Robert F. Kennedy, Mr. fucking Make America Healthy Again, I'm not doing shit and I'm a fucking anti-vaxxer, choke on my fucking cock, when he was out there saying, oh, well, you know, when he was being questioned by Bill Cassidy, Cassidy's asking him, like, look, I believe in vaccines. I'm a doctor. Vaccines have saved millions of lives, billions of lives possibly. What are you going to do about vaccines? And Robert Kennedy says, well, of course we're going to keep vaccines, Senator. And Bill Cassidy, who's a doctor and has seen Kennedy's record on vaccines and all of the anti-vax bullshit that he has peddled for decades, says, well, are you sure that you're actually going to do this? And Robert F. Kennedy says, yes, sir, golly gee whiz. Yes, I'm going to stop being the piece of shit that I am, and now I'm going to support vaccines. And Bill Cassidy says, well, golly gee whiz, that sounds good to me. He assured me. And then what does Cassidy do? He votes to actually put Robert F. Kennedy as the director of Health and Human Services in America. And what's going on right now with the Centers for Disease Control? They're basically gutting vaccine protocols in the United States, which is going to result in the death of how many people, I don't know. And now Cassidy's like, well, I can't believe that Robert F. Kennedy, a known liar, has lied to me. No fucking shit, Cassidy. He knew this all along. The same thing with Cassidy. Because he's a fucking doctor, he knows exactly how expensive healthcare is. Cassidy became a very wealthy man by being a doctor. He made a lot of that money. And he knows that $1,500 a year is nothing. It's piss. And that's what he's doing, is pissing on the American people. And what are they all saying? Well, we'd rather have the money go to the American people rather than the health insurance companies. Fuck you. The money's going to the health insurance companies one way or the other. Because we have the system in America, we actually allow health insurance companies to exist, unlike most sensible industrialized democracies in the world that have universal health care, but apparently we're too stupid, but really too greedy to actually do that. And what has Trump done? Nothing. Nothing. President Trump basically has sat there and done shit, but then he said, I support the Cassidy-Crapo approach. Oh, whoa. Wonderful world, wonderful, Mr. Trump, Mr. President. You support it, great. That was replacing Obamacare with something great. No, that's the concept of the plan. No. $1,500 a year, that's what you get. $100 a month, okay, a little over $100 a month to pay for healthcare. How the fuck are you going to do that? Quote from Trump, we have an idea that rather than making these massive payments to insurance companies, we make beautiful big payments, fuck you, directly to the people, and they buy their own. Trump said in response at the black tie event at the White House, who the fuck is going to buy health insurance for $1,500? I pay more than that per month to cover my family. And you're telling me that people are going to buy health insurance for $1,500 a year? This is where we are. This is coming. Okay, there's no doubt about this. These assholes are on vacation on December 15th. At the same time, that's when health insurance premiums are going to go up for the following year. Americans are going to get sick. Americans are going to die. And it is Republicans, and especially Donald fuckface, choke on my cock, fucking rat Trump, who has made them sick and who is killing them. That is your reality in America. All right, that's enough for today. I'm pissed. Check out my music. I'm going to spend the rest of the day making music instead of fucking worrying about this shit. And yeah, it's by me, Lex Dynamic, on Apple Music, Spotify, and all the rest.